Thank you, Mr. President. I rise first and foremost with great appreciation to our Majority Leader, Senator Andrea Stewart-Cousins, and the tireless Senate staff who have worked so hard these past few months during budget negotiations. This budget is not just about numbers. It makes investments in life-saving care for New Yorkers. It's no secret that mental health is complex, mental health is nuanced, and it requires our careful attention. The current mental health crisis requires us to reimagine and redefine what mental health care looks like in New York State. But our reimagination of what can be doesn't have to include expanding involuntary commitment. Our state budget reflects our values, and when we expand forced detentions while cutting funding for evidence-based services that have the power to transform lives, we are sending the message that coercive action is the statewide priority. These evidence-based services are life-saving and effective programs like Inset, Peer Bridgers, Clubhouses, and our ACT and SOS teams. In fact, medical research tells us that forced detention and treatment do not improve care and individual outcomes. A study from Bellevue Hospital compared the effectiveness of voluntary and involuntary outpatient treatment and found there was no statistically significant difference between rates of rehospitalization, quality of life, or arrests. We know linking mental health care with criminalization is not the answer. People with mental health conditions, as my colleague Senator Harkin pointed out, are more likely to be victims than they are to be perpetrators of crimes. I'll repeat, those with mental illness are more likely to be the victim of a crime than to be the perpetrators of a crime. So this begs the question, why are we expanding involuntary commitment when we could be funding ACT teams and other voluntary services? We know that these evidence-based treatments work. To that end, I'm proud of the steadfast work of the Senate to reimagine crisis services here in New York State and fight for peer-led support and compassionate, culturally competent care, which we are doing by putting key pieces of Daniel's Law into this year's budget. This budget bill is far from perfect, and I fear the negative impacts we will see with the expansion of coercive measures. However, I remain proud of the progress it makes to improve and transform our mental health crisis response system. And for that reason, I vote aye.